As the deadly Ebola virus continues to ravage some parts of West Africa, international medical and teams will visit eastern Sierra Leone to try to deal with an outbreak of the highly contagious disease. The experts are from the World Health Organization and the Doctors Without Borders charity. And this comes after 6 suspected Ebola patients were taken out of hospitals by their families, defying doctors. One of the patients later died and fears that the virus could spread.
Guinea's capital, Conakry, has recorded its first new Ebola cases in more than a month, while other previously unaffected areas have also reported infections in the past week. This is according to the World Health Organization. The spread of the 2-month-old outbreak, which Guinean authorities earlier said had been contained, risks further complicating the fight against the virus in a region already struggling with weak healthcare systems and porous borders. 7 confirmed cases and 9 suspected cases of Ebola are being dealt with in Sierra Leone. The announcement comes after the WHO said on Monday that 5 people had died in the country's first confirmed outbreak of the virus, signaling a new expansion of the disease, which regional officials said had been brought under control.
For Ebola in Sierra Leone, the last few days, we have a total reported of 7 confirmed cases and 9 suspect cases. All of them are reported in the Quindu area district, which is in the Kailaun prefecture, which is bordering Guinea and notably bordering Gektedu foci of Ebola in Guinea.
Ebola, a hemorrhagic fever with a fatality rate of up to 90%, is believed to have killed some 185 people in neighboring Guinea and Liberia since March, and the first deadly appearance of the disease in West Africa. Authorities have identified several ways the virus has been transmitted, but human to human is the most prevalent form.
We have been able to identify several chains of transmission. One of them start, I would say, in the forest, but more importantly, this chain of transmission have lasted for 6 months now through contact, human-to-human transmission, so human contact, and again through caring of people without precaution, through nosocomial amplification with transmission within healthcare facilities, and through people attending funeral without precaution and being in contact with people dying of Ebola.
The West African outbreak spread from a remote corner of Guinea to the capital, Conakry, and into Liberia, causing panic across the region.
Well, joining us now is Dr. Osahon Enabulele. He is the president of the Nigeria Medical Association, to talk to us more about the story. Thanks a lot for joining us on the program. All right. Well, everyone wants to know if there are fears or the possibility that the Ebola virus could spread to Nigeria, considering how it's been moving around lately in West Africa.
Hello?
Yes, I can hear you. Can you hear me?
Yeah, I can hear you now.
Okay, I just asked you if there are possibilities or fears that this virus, the Ebola virus, could spread to Nigeria, considering how it's been moving rapidly across West Africa.
Yeah, certainly if you consider the fact that Nigeria has a very huge population, and of course with lots of migration activities, then the possibility is always there. People move into Nigeria every now and then. The entry to Nigeria is enormous, and that means that you could have a lot of cross-border activities, taking place. And when you have that kind of mix, the chance of having, those kind of that kind of spread, anticipated spread is there. In terms of the fact that this is even a viral illness that we're talking about, is a viral condition, and so which of course can be facilitated by the density of the population, and of course the fact that people are moving from place to place, and of course in and out of the country. And so the possibility is always there, the suspicion is always there, and so it's for us to understand that, and of course put in these measures to of course reduce transmission.
What would these measures be? Because now you've reeled out all the scary things no one wants to hear. Because right now, to make people not move around the border will definitely be a very difficult thing to carry out. What are the other preventions that we can immediately tap into?
Well, the issue of prevention, really, the intervention can be at different levels. At the personal community level, at the governmental level, and of course at institutional facility level in terms of the health facilities. Generally, like we know, the Ebola virus disease is a severe acute viral illness, which can sometimes be very fatal, and usually starts with symptoms of fever, along with other conditions like symptoms like intense weakness, body pain, headache, sometimes vomiting, diarrhea, and of course bleeding episodes. What therefore needs to be done in the light of the fact that there is really no specific treatment for it is first to have a higher level of suspicion, and of course try to develop some risk reduction measures to limit the spread and of course acquisition of this infection of individuals by the virus. Like I said, at the personal level, still the issue of public education is very important, health education. And that is where government comes in terms of pushing out messages to the public on a consistent basis to enlighten the individuals, to enlighten the citizens about this whole condition. And of course, the available risk reduction measures or disease containment measures that can be taken. Still at the personal level, basic issues of personal hygiene, particularly hand hygiene, is very key because this is a disease condition that is spread, directly by through contact with infected persons or infected animals. The bodily secretions, the bodily fluids, the blood, once you get in contact with it, especially through vocal mucous membrane.
That's right.
The chance is there that you'll be likely to be infected by the virus. So basic hand hygiene, such that at every point in time, especially if you come in contact, or rather you are within an environment where you have this kind of situation.
Thanks a lot, Doctor. Thanks a lot.
You wash your hand regularly.
Wash your hand regularly.
Those who visit, for those, especially those who also visit patients in the hospital, you make sure that you always wash your hands.
Wow.
That's the patient.
Okay.
Because the reality of this condition is that it can be.
All right, Doctor. I'm sure it's something we have to keep talking about on this program, and of course in every other platform out there. Make sure you wash your hand every now and then. On that note,
For government also, the issue of health services, about the kind of strengthening the health services in our country.
All right, sir.
It's something that government needs to work seriously.
All right, sir. Doctor, we would have to leave it there for now. Thank you so much for joining us on The World Today. I have been speaking to Dr. Sahan Enabolele, President, Nigerian Medical Association, on the... That's right. Okay, so thanks a lot, everyone, for watching the program. Wash your hands regularly. You've been watching The World Today. I am Adeshewa Josh. Sports news is on next.